There's a fairly common recommendation from many orthopedic surgeons that a patient with hip or knee arthritis shouldn't walk for exercise. In this Ask the Doctor video, I discuss the pros and cons of walking, even with bone-on-bone arthritis. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. This video is yet another video in my Ask the Doctor video series based on questions you've left me in the comments to the videos on my YouTube channel. And this is one I talk about a lot, so I wanted to do this one the minute I saw it. Here's the question. I have bone-on-bone knee arthritis. Is walking for exercise a bad idea? And I will say, like this video and every other video I put on social media and on my website, this is not medical advice. This is meant for general information and educational purposes only. Please talk to your doctor. Having said that, I vehemently oppose this idea that you shouldn't walk if you've got bone-on-bone hip arthritis, bone-on-bone knee arthritis. Same with running. Now, it can be painful enough that that becomes difficult, but especially once it's bone-on-bone, there's not much risk that you're making the joint worse. But even early arthritis, this idea that running or long-distance walking, long-distance impact exercise is making the joint worse has largely been debunked. That is old school thinking, and it's not been shown to be true. And in fact, impact exercise is thought to be good for articular cartilage in terms of moving the synovial fluid around, being good for the resiliency of the cartilage. I would strongly encourage it. Plus, a lot of people like to run for exercise. A lot of people like to walk for exercise. And I have not seen compelling evidence that you shouldn't do it, that it's going to speed up the problem, speed up the arthritis. Now, sometimes due to pain and some other things, maybe you have to cross train, and some days you walk or some days you run, but then other days you do non-impact exercise like swimming or lifting weights or bike. There's all sorts of things you can definitely do, but there's just not great evidence that walking is necessarily bad, that running is necessarily bad. They've looked at marathon runners compared to similar age-matched control patients that weren't marathon runners, and the marathon runners, lower rates of needing joint replacements, lower rates of progression of arthritis. It's just not something that I tell patients, but I hear it so often from other patients. Now, if you have an orthopedic injury, maybe you have arthritis and you want to hear about other options other than surgery or cortisone shots, or just want a different perspective than your traditional orthopedic surgeons, click the link in the description under this video. You can fill out the contact form and learn more about scheduling an appointment with me. Also, I'd love to hear your experience with your injury, so leave those in the comments below. Just understand, if you leave a question in the comments, I can't offer you medical advice, but I might answer your question in a future video. Make sure to subscribe to my channel, click the bell above to be notified when I release a new video and when I start my Ask Dr. Geier live shows. Thanks for watching. I look forward to helping you feel, look, and perform better than ever.